So we've got an awful lot of people displaced. I think there's now around 1 million displaced in Borno State itself. Malaria is the #1 single causative agent causing suffering and death. Nothing beats it. So far, the death rates that are truly attributable to COVID-19 are relatively low compared to any of the other causes of disease. But the impact on the health system is huge, in that it creates a very unsafe environment for people to seek treatment. And that's because the health system is really on its knees, and they've got no means of disinfection. So yeah, the real impact is visibly on health facilities closing, but the real major impact of that is deaths increasing dramatically.
In the early weeks of the pandemic, there is this general fear globally about getting infected. So it becomes a challenge for even the health workers to have the confidence to stay in the health facilities and provide their services. So gradually, we have to come up with strategies to ensure disinfection of all surfaces in the clinic, how they triage patients, especially patients coming with likely symptoms of COVID.
And when we looked around, we realized nobody has ever created a disinfection kit for this sort of setting. There simply hasn't been one. So we started a discussion with SC Johnson and to see if we could generate the first of a kind, readily made, high quality disinfection tools assembled in a way that would be adequate to keep a health facility sterile. And we formulated that into a kit.
So we have hand sanitizer that we produce here. We have a concentrate disinfectant. We have disinfecting wipes. We have bar soap. We have nail brushes so people can clean their hands really well at the health centers. And we have pictogram instructions so that regardless of what language the health centers are speaking and reading, they'll be able to understand the proper use of the products.
We think that with the current scale of conflict and contraction, by reaching 100 and keeping them open for a minimum of 4 months to 5 months, we'll get through the worst of the COVID outbreak setting. We'll keep the best part of half the health facilities fully functional, and we think that that goes an awful long way to meeting the needs of almost 2 million people. So it's a unique partnership. But as soon as we started discussing together in this setting, everybody realized this is common sense. It's a no-brainer. So without it, more people will die of malaria. With it, more people will continue to be able to access healthcare, diagnosis and treatment, and will survive.
So this intervention is not only giving protection in the context of the COVID, but also promoting services to other endemic diseases here, like vaccine preventable diseases like malaria, like malnutrition and all those things. So the support we are having is a life-saving intervention. So I thank you very much for all the support that we got, we are getting. Thank you very much.